What is lupus?
What causes
What
it?
are the symptoms?
Is there a cure?
What do I do?
Can men get lupus?
What if my child has
Is it fatal?
How do I tell people?
Where can I get help?
I need to know more.
No lupus.
End the confusion.
There are 4 different types of lupus: systemic, discoid, drug-induced, and neonatal. Discoid lupus is a chronic skin condition and can be localized or generalized and can begin in childhood. Drug-induced lupus is caused by certain drugs and is often caused by hydralazine, procanamide, and isoniazid, and typically lessen once the drug therapy is terminated. Neonatal lupus is passed in utero from the mother to child. Infants with this are born with a mild rash that typically disappears within 6 months. Systemic lupus, or SLE, is commonly just called lupus. Lupus is a chronic autoimmune disorder characterized by periods of flares or exacerbations and remission. This disorder is incurable and is also unpredictable. It can affect each individual differently, ranging from mild to severe, involving multiple organs in the body. Lupus is associated with increased mortality, increased comorbidity, and lower health-related quality of life. This can affect any part of the body: musculoskeletal system, skin, kidney, cardiac cells, and nervous system. In SLE individuals, the immune system creates autoantibodies, which are antibodies to the body's own proteins, which then form complexes that cause injury and pain. Lupus is an exacerbation-remission disorder with long-term consequences, meaning the disorder will have symptoms that worsen and then disappear. And this is the type I will be talking about with you today. SLE is the most common of the different types of lupus. It is estimated that lupus affects 322,000 to 1 million people in the United States. 80 to 90% of cases showed that lupus generally affected females. The female to male ratio in childbearing years was reported to be about 12 to 1. Because of this ratio, it shows that hormones play an important factor in the pathogenesis of lupus. The distribution of age is very broad, ranging from children about 2 years old to 80 years or older. 20% of cases are diagnosed before the age of 20. Children who are diagnosed and affected by this tend to have a more severe onset and follow a more aggressive clinical course. But females start to become symptomatic at a range of 15 to 44 years, but studies show that the max age in women that get this disorder ranges from 45 to 64 years old. The highest risk for lupus is during childbearing because of the hormonal changes. Studies also showed that the race also had a factor in the disorder. Lupus has been found more frequently in African American, Hispanics, and Asians than Caucasians. The 10-year survival rate is 85%. Many scientists believe that there are many causes as to why people get lupus. They can be inside or outside causes like hormones, genetics, or the environment. There have been some studies on women who have lupus to see if estrogen has any correlation with the disease because it is shown that women have a greater chance than men. The studies have shown that women tend to have lupus symptoms around the time of menstruation and during pregnancy when the hormones are high, but they have not shown this yet to be an absolute cause. Scientists have been able to find genes that correlate, not cause, but correlate with lupus. But somebody can develop lupus even with no family history of it. Also, some scientists created a hypothesis that the environment can cause lupus due to viruses or chemicals that may have triggered the disease. There is no known specific cause to this disease, but there are factors that correlate with the development of lupus, like the gender, age, race, temporal variations, regional variations, genetics, and the environment. Lupus affects each individual differently. ranging from mild to severe, involving different organs of the body. It is known for this disease to have periods of flare-ups and remission or lack of symptoms. Flare-ups or flares are when the symptoms worsen and the individual feels ill. These flares could be caused by exposure to sun, stress, fatigue, pregnancy, or childbirth. The symptoms could range from a fever to being hospitalized from it affecting organ function. These symptoms can limit the level of activity of the individual. Fatigue is one of the most common symptoms of lupus and is affecting about 80 to 94% of those diagnosed some point in their course of illness and impairs the patient's quality of life. This common symptom is sometimes caused by the underlying medical problem like anemia, fibromyalgia, depression, kidney, or thyroid problem. It can also be side effect of medication, which can be treated by changing the medication. Approximately 50 to 90% of patients report having pain in the musculoskeletal system, affecting joints like fingers, hands, wrists, and knees, causing some patients to develop secondary osteoarthritis or swelling of several joints. A lupus patient's skin is often affected, showing the hallmark sign, a butterfly rash, which is over the malar eminence of the face, sparing the nasolabial folds. Patients can also present with hair loss, red and scaly patches that turn into plaques, and oral ulcers, as well as photophobic skin responses to sunlight. Research has shown that exposure to UV light can exacerbate skin disease in patients. Because of this individual, they may need to give up outdoor activities to limit their sun exposure. If that is not an option for them, they can wear extra clothing, use an umbrella or a hat to protect them from sunlight, or they can use sunblock. So what does lupus look like? Well, you may not be able to tell that somebody has lupus like Selena Gomez.
I had arthritis. My kidneys were shutting down. My mentality was just to keep going. I didn't realize how much it was affecting my body.
This past summer, Selena Gomez was gravely ill, weeks away from dialysis and in desperate need of a new kidney.
My kidneys were just done. That was it. And I didn't want to ask a single person in my life. I guess I got to the point where it was really kind of life or death. It's really hard to think about or even to swallow, especially now that as soon as I got the kidney transplant, my arthritis went away. My lupus, there's about a 3 to 5% chance it'll ever come back. My blood pressure is better. My energy, my life has been better.
Shannon Box or Nick Cannon?
I got diagnosed with lupus nephritis, and it was actually where it's an autoimmune disease that attacks my kidney. So I had no idea what that was. So I didn't really know what to do, and it was real scary for the first few months. But then I take my test and turn it into a testimony, ultimately. And I say it's one of those things where it's made me stronger. It's definitely, I feel like I'm in better shape, better health than I've ever been before because it's allowed me to pay attention and focus more on my health and making that a #1 priority. And at the same time, I say I have lupus, but lupus doesn't have me. So I'm one of those people that want to wave the flag and say, hey, you can win this fight.
People may be able to hide it well enough to not be able to notice, but if they have a flare-up, they might show a sign of butterfly rash. The picture in the bottom right shows what somebody with lupus having a flare-up with a butterfly rash may look like. It is very difficult to diagnose somebody with lupus because it is very unpredictable, as well as it showing similar symptoms to other diseases like MS and chronic fatigue syndromes. Because of the musculoskeletal involvement, rheumatoid arthritis and mixed connective tissue disease like scleroderma or dermatomyositis may also produce symptoms similar to lupus. It is also often mistaken for other illnesses like arthritis. According to some scientists, lupus is thought to be a combination of diseases, which makes singling out specific symptoms unique to one disorder problematic. About 30% of patients with lupus will present with fibromyalgia. When trying to diagnose a patient, it is important to rule out leukemia and lymphoma. To help diagnose these patients, several blood tests will be taken. The presence of anti-nuclear antibody, anti-Smith antibody, and anti-double-strand deoxyribonucleic acid antibody are all helpful in the diagnosis. Other lab tests including the determination of the erythrocyte sedimentation rate, which indicates the level of inflammation in the body, and a urinalysis to determine whether protein or blood is present. Chest x-rays and electrocardiograms may be ordered to evaluate the level of possible lung and cardiac involvement.
Let me mention for a second some of the lupus blood tests. There's the anti-nuclear antibody. Now, an antibody is something that tends to protect you against viruses and bacteria and other germs, but sometimes antibodies can be kind of interdirected against some of your body's own substances. So an antibody against the nuclei of your cells, an anti-nuclear antibody, is common in lupus. It doesn't mean that you have lupus. It means you're susceptible to lupus and could have it or could develop it. But by itself, it doesn't mean all that much. Now, the next antibody that we look at in the blood is anti-DNA antibodies, antibodies against your DNA. And if you have those, you're also more susceptible to lupus, perhaps may have symptoms of lupus. Another type of antibody that's common is anti-Smith or anti-SM for Smith antibodies. Those are fairly specific for lupus. They don't mean you have it. They mean you might have it. One has to look into it further, and if one can match the blood tests, such as these antibodies, to your symptoms, that's the way we can confirm a diagnosis of lupus. Other tests that are used to monitor lupus include the complement test. Sounds like somebody's giving you a compliment, spelled a little differently. They tend to get low and active lupus. And we monitor the inflammation tests in the blood, like the SED rate test, SED, SED rate test. So that sometimes when someone comes in, I want to know if they have lupus and which laboratory tests I'm going to focus on in their special case to follow the lupus to see if I put them on treatment such as prednisone or Imuran azathioprine or methotrexate or Cellcept or Plaquenil. How are they responding? Partly it's their symptoms, but partly it's the tests that were abnormal at the time when they were sick, and if those tests have improved or not.
Patients are diagnosed with lupus by having at least 4 of the 11 criteria: a neurological disorder including seizure or psychosis, renal disorder, ulcers, either oral or nasopharyngeal, a butterfly rash, skin photosensitivity, seriositis, including pericarditis or pleurisy, hematological disorder, including leukopenia and lymphopenia, thrombocytopenia or hemolytic anemia, elevated anti-nuclear antibodies, a discoid rash, which is a coin-shaped rash on any part of the skin that appears when the patient comes in contact with sunlight. It usually appears on the scalp, neck, hands, and feet. An immunological disorder, as indicated by the presence of anti-DNA antibodies, anti-Smith antibodies, and anti-phospholipid antibodies, or lupus erythematosus cells, or the presence of arthritis. The goal of treatment for these patients is to reduce the acute symptoms while avoiding the progressive damaging effects of the disease in the long term. The current treatment plan for individuals with lupus includes 3 major medication classes: corticosteroids, immunosuppressants, and antimalarials. There isn't just one drug that an individual can take, but many different drugs can help control symptoms and relieve discomfort. Patients may benefit from nonsteroidal anti-inflammatories for those who suffer from musculoskeletal pain. but patients who have a more severe case of lupus may need corticosteroids or immunosuppressants. Corticosteroids have been the main focus for treatment with the symptoms that affect the renal, nervous, and hematological symptoms. Even though corticosteroids may help extremely for these patients, the many side effects may complicate the disease itself. With the patients taking this medication on a long-term basis, they have a likelihood of infection, osteoporosis, avascular necrosis, steroid-induced diabetes, and several skin ramifications. Doctors who help treat these patients usually go with the lowest dose possible that controls the disease while limiting the side effects. For pain management, patients have come to find that there is relief in natural remedies like Tai Chi and low-impact yoga, as well as acupuncture, biofeedback, massage, and physical therapy with moist heat, baths, showers, and chiropractic care. Because of the long-term use of corticosteroids to treat many patients with this disease, they have a much higher risk of osteoporosis, as well as high risk for avascular necrosis, typically presenting in the hip. This affects up to 14% of patients with lupus and typically requires surgery for treatment. Patients who have skin manifestations, like the more severe cases of lupus, have shown positive effects of using anti-malarial medications, such as Plaquenil. There currently isn't anything that can be done to prevent the development of lupus, but there is a way that you might be able to slow down the process of the development. Early diagnosis is the best way, as well as avoiding triggers, to help with the management of the disease. To aid in the treatment of lupus, a rheumatologist, one who specializes in muscles, joints, and bones, may help with treatment with medications or therapy to help lessen the symptoms. Lupus is one of the leading causes of work disability in the United States. There is more than 1.5 million Americans with work disability and lupus, which covers 20% of that. It has a huge impact on individuals' employment and careers. The functional limitations are due to the multiple organ involvement, symptoms, variable activity, severity, and damage. The functional limitations that affect people with lupus the most are physically demanding activities like sitting, standing, walking, lifting, pushing, pulling, bending, etc., causing them to have a difficult time working. Because this disease limits the level of activity in an individual, it causes them to have a difficult time keeping up with everyday tasks like work or school. According to a survey, lupus affects the careers of 7 out of 10 people living with this disease. That comes to about 22,540 to 700,000 people whose careers have been affected because of this. Because of this illness and disability, it may potentially affect a range of psychological, physical, and environmental and social demands. A person that has this lupus results in physical challenging and psychological distress such as fear, hope, depression, anxiety, desperation, and low self-esteem, fear of death, paranoia, and may contribute to feelings of sadness and stress, which can cause significant functional and emotional challenges. Like I said in the previous slide, people diagnosed with lupus frequently experience physical, emotional, and social demands that often result in unmet biopsychological needs. A study showed that people with this disease have lost the ability to perform tasks that they were once able to do before the diagnosis because of psychological impact that it puts on them. The physical side of lupus tends to show fatigue, weight gain, increased sensitivity to sunlight, and can also trigger emotional reactions while also making the person feel isolated from family, friends, and coworkers. Because this disorder can cause fatigue or pain, many providers will suggest the parent or patient with the disorder to look at talking with their teacher or professor about accommodations for the person. This can include registration early, so that it can help with working around their treatment, personal needs, medication schedules, and variations of their energy level. The person can also be suggested for a reduced course load, which would assist in the person by helping with the removal of stressors that can trigger the flare-ups, which can help the academic load manageable. With this disorder, they may have trouble making classes on a regular basis because of flare-ups, so it is also possible that the person have a part-time enrollment for an institution. Flexible attendance would help because it wouldn't negatively affect the person from missing multiple class times and affecting their grade. The person may also recommend having frequent rest breaks to help with their chronic pain. Counseling is also a really good accommodation for the person because it helps with the emotional aspects of the illness, and they may receive advice regarding dealing with the stress and trying not to become overwhelmed by social workload, school workload, and assignments on top of their illness. Another challenge that people with lupus face is the fear of death. Kidney problems are a major cause of morbidity and mortality among patients with lupus. But death in people with lupus can be slowed down, and this is because people with lupus tend to have organ trouble or failure, and the reason people are dying because of lupus is because of kidney failure. But the frequency of people with lupus dying from kidney failure can be decreased by therapy, kidney dialysis, and possibly a transplant. Scientists are not yet sure why this is a cause of death for lupus patients, but they do recommend that people who have lupus have a regular schedule for exercise, weight control, a diet, medications that may help with dieting and weight control, and no smoking. Many of these complications may be caused by the side effects from long-term corticosteroid use. Due to the decline in kidney failure from different treatments, heart attacks and cardiovascular disease have increased in the leading cause of death in people with lupus. The heart may possibly show manifestations including premature atherosclerosis of the arteries surrounding the heart, which occurs in 6 to 10% of patients. Blood clots will form in the circulatory system, occurring in these patients because of the production of specialized antiphospholipid antibodies, which are a group of immune proteins or antibodies that the body mistakenly produces against itself in an autoimmune response to the phospholipids. These patients also commonly develop anemia and a low platelet count that at times can be severe and require transfusion. Athletic trainers need to be aware of this disease and keep it in the back of their heads so that if they see a patient with an unexplained joint pain and swelling, especially seen with a butterfly rash, should refer these athletes to a physician for further testing. They need to keep in contact with the physician to know treatment plans as well as other healthcare providers the athlete is seeing depending on the organ system being involved. Along with the primary care physician, the athlete may need a rheumatologist to oversee the care given, nephrologist for patients with kidney disorders, hematologist for those with blood manifestations, and orthopedic surgeons for those with avascular necrosis. The athletes with lupus may have trouble concentrating, sleeping, or may just have psychological problems they need help dealing with. And you, as an athletic trainer, can help them overcome these. You can also help them if they want or need a referral to a psychologist or any other healthcare provider needed. They also may need certain exercise regimens, so you are the one responsible for keeping their joints moving to help with that synovial fluid and to also help with the slowing down of the process or preventing rheumatoid arthritis in the athlete. It is also important to pay attention to what medications the athlete is taking, because if they are taking a corticosteroid or for chronic use, it is the leading cause of death in the patients along with renal and neurological disease. You're going to see these patients on a daily basis, so knowing their treatment, medications, and their personality will help you see the signs of these harmful side effects from medication. Once the athlete is ready to participate and return to full activity, it is important to monitor the exacerbations and new complications from the disease with balancing the exercise and their treatment. If you have an athlete or patient that has been recently diagnosed with lupus, this is a website that has all the information they need about this disease. It is also a good resource for yourself if you ever need it in the future.
It's important to spread awareness about lupus for a few reasons. I mean, mainly, the more awareness, then the more people are familiar with the disease, and a lot of the misconceptions about lupus can be cleared up. But then, even more importantly, when you create awareness, you can also raise the proper funds for more research and better medicine, and everything from getting everyone to understand that we are looking for a cure ultimately. So it's everything from clinical trials to so many things that when you teach people and allow them to be aware about lupus, it helps further that mission.